Good evening, everybody. Thank you so much for joining us tonight. We're live on Calderdale Council's Twitter, YouTube and Facebook page. If you're watching on Facebook, you can submit a question to the question and answer session to the panel by commenting in the live chat below. And if you're watching on YouTube, you can submit a question in the live chat section on the right-hand side of your screen. And obviously the focus today is about bringing the Calderdale infection rate down. The question and answer will be about an hour long and we'll wrap up around 8 o'clock. If you are watching on Facebook, please share the live session with your family and friends, and the session will be available to watch on replay once we're offline. So I'm absolutely delighted to have a fantastic panel this evening. I'm going to ask everybody to introduce themselves. I'm Deborah Harkins, Director of Public Health at Calderdale Council. I'm going to pass on to Owen. Do you want to introduce yourself?
Thanks, Debs. Yeah, my name is Owen Williams. I'm the Chief Executive of Calderdale and Huddersfield NHS Foundation Trust, and I'm pleased to be on this call today and hopefully can explain why I think it's so important, why we need to get that infection rate down.
Thanks, Owen. And then I've got Dipika. Do you want to introduce yourself?
Good evening, everybody. My name is Dipika Kaushal. I'm the Chief Executive Officer for Voluntary Action Calderdale, and just want to kind of reiterate what Owen said. You know, it is all about getting infection rates down, and really pleased to be part of this panel this evening.
Thanks, Dipika. And Toni.
Thanks, Debs. Hi, I'm Toni Williams. I'm a public health specialist working for Public Health England, and I predominantly work across West Yorkshire, supporting local areas like Calderdale to bring the rate down.
Okay, thanks everyone. Well, we've really reached a critical point in the COVID-19 pandemic in Calderdale. The rates of infection have increased in recent weeks, and Calderdale's actually ranked 20th of the 144 local authorities in England for COVID-19. We've actually got an infection rate today, well, the most recent data, which is the 7 days prior to 14th of November, of 494 per 100,000. That's the highest the rate has ever been in Calderdale. And we're continuing to increase testing, with more than 1,000 people tested each day now, Calderdale residents. But unfortunately, 16.7% of Calderdale residents that are tested are having a positive result. That's compared to a rate of around 9% nationally. So the situation is really serious. So what I'm going to do is I'm going to ask our panelists each just to say a little bit about what the impact of COVID-19 is currently in your area of work, and also ask why it's so important that we bring the infection rate down. So I'm going to start, Owen, with yourself, if you want to answer that question for us.
Yeah, thanks, Debs. So when I came into hospital this morning and I looked at some of the data that we see regarding how the hospital is and stuff like that, what I could see just this morning, since the 1st of November, 63 people have lost their life to COVID. In total, there's been 115 deaths, but 63 represents the majority of those deaths. And if you think about that, that's in 19 days, we've effectively lost at least 3 people a day. And many of those deaths probably are premature deaths. They're probably deaths that could have been prevented. And on top of that, in terms of how that impacts on colleagues right across the trust, whether they're doctors, nurses, therapists, cleaners, porters, you know, we're all in this because our mission in life is to, in effect, give people a good birth, a good life, and a good death. But our mission in life is really about, we want people to live as full a life as possible. So it's pretty soul destroying when you're seeing that level of death and you're asking yourself the question, how much of this is preventable? And, you know, what I would just say, it just seems kind of an odd irony when I think about, you know, we've just been going through the Poppy Remembrance few weeks, and to see particularly so many of our elderly people passing to this disease, and to know what those people did in order to give us all the opportunity of the life that we have now, and to think that, for example, just wearing a mask and social distancing and sanitizing and washing hands could make such a difference. It really feels desperately difficult for colleagues at the moment, you know, because we're in the business of saving life. We're not in the business of just seeing people pass away and die. So that's kind of what it's been like. There's no positive situation I can put on that. And just one final thing I would say: there's two colleagues who have stuck in my mind just this week. Both of them were in tears. One colleague was in tears because the overwhelming level of pressure trying to deal with the volume of patients, and that feeling when people are knackered and tired and they want to go home, but they feel they can't go home because they might be letting their colleague down, or they feel like they're letting a colleague down, or they might be feeling that that patient might not be there in the morning, is a tremendous amount of pressure. And then another colleague was in a really difficult space because they were having to shield at home, but actually wanted to be here with their other colleagues, trying to keep people alive and trying to look after people. So I just really wanted to take the opportunity to convey that and really get people to understand where we're at. So thanks, Debs.
Thanks, Owen. It's really, really powerful, the impact this is having on our health and care workers. And thank you so much for sharing that. Dipika, do you want to say a little bit about the impacts that COVID's having on you, your part of the world, and why it's so important to bring the rates down?
So in our part of the world, which is a voluntary community sector, who are playing a really critical role in and around Calderdale, I think the positive impact is that our organisations are doing their very, very best with very limited resources to continue to offer services to those who are most vulnerable in society. They are seeing an increasing number of people in need and who are accessing support. And as part of that, there's extreme pressures on our sector, particularly when funding is reducing all the time. So there's real financial pressures. There's a lot of risk for our workforce as well, because some of the work they do has to still be face-to-face. They are essential in terms of some of the support they offer around the food banks, around ensuring that people who are the most vulnerable in need of care are being supported. So actually keeping our vulnerable people supported is a priority, but it does come with risks. So again, really our plea is for people to take those simple precautions. Please wear your masks. Please help those people who are there to help you, and really help Calderdale, help our communities. Just a couple of points is that our workforce equally is absolutely on its knees, working many hours to ensure that we are absolutely flexible in the way we are delivering services. And that means not only the working week, that means the evenings and weekends as well. And just thanks to all the volunteers out there who are doing a grand job. We are working with our partnership working with the council, with our NHS colleagues, is really important, because only by working together are we going to bring those freedoms back for our communities. All of us, in fact. We protect our loved ones and also keep our livelihoods, because there are people who are losing their jobs in droves out there, and that is exacerbating, increasing the level of poverty and the pressures on our communities. So I think we all have a part to play here. We're all part of one community. We're in it together. So let's all kind of play our part and help to get Calderdale reducing the number of infections and cases.
Thanks, Dipika. And Toni, finally over to you in terms of that first question.
Thanks, Debs. Well, Owen highlighted some pretty grim figures there in terms of, the number of people who have died due to COVID. Across the area that I cover, West Yorkshire, over 2,500 people have died so far this year. We are seeing that number start to increase again. Around about 150 people are dying every week across West Yorkshire, and probably about a quarter of deaths that occur in Calderdale, you can probably attribute them to COVID. Because it's not just about the number of people that die. We're learning more and more about so-called long COVID. So even if you might have a short illness, we don't really know that much about the long-term impacts that will have in your health and your well-being. But we do know that, some people will have those effects that last many, many months. And so my final point would be, it isn't just about, the most vulnerable people in our communities. This is having a huge impact on all of us, but in particular, children. So whenever we get a case in a school, in a class or a bubble, we have to isolate the rest of that bubble. And that's to prevent the infection spreading throughout the school. 2 weeks out of education is massive. A lot of the research that came out over the summer about the impact of the first lockdown was really, really negative with regards to children. So not only did we see the attainment of children kind of stall, we saw some children, some of the most vulnerable children, actually regress in terms of their skills and their abilities. And I think that just cannot continue, because that is an impact that we will live with for many, many years. So I suppose from my perspective, this is about protecting the most vulnerable, but protecting everybody in our communities. We've all got a stake in this.
Thanks, Toni. And it's interesting, and just looking at the questions, we've got to, just while we're talking about schools, we've actually got a question here that I can see that talks about the rising numbers in schools for both primary and secondary over the last 2 weeks is alarming. Is it time to review schools staying open? And I think, Toni makes a really, really important point that in the first lockdown, children did really bear the brunt of that lockdown, and that the harm potentially that can be done to children for significant period of their lives, for the future lives, because of missing so much school, is really important in terms of their health and well-being and life chances moving forward. And I know I'll ask others to come in, but I know my personal view is that that's absolutely critical, that we do everything we can so that schools can stay open. And I was thinking about this the other day, that if we are going to keep schools open, if it is so important that children continue to go to school, what that means is that if we're going to have the same impact as the first lockdown, the rest of us need to reduce our contact with other people even more than we did in the first lockdown. And I think that's something we can do to show our kindness and our support to our communities, so that we don't have an ongoing impact on children and young people who are really potentially going to have the greatest harm. I don't know if anyone else wants to come in on that question about schools. Do you want to come in? Anyone want to come in, Dipika?
I think I just wanted to mention that, I know there's concerns about schools remaining open, but we also have to think that there are sections of the population where, that there is digital poverty, basically, and actually a lot of young people are going to be really impacted, not only by not attending school, but also in terms of not having the right equipment at home, not having the support structures that schools can offer. So I think it is about being kind. It's about making sure that our young people are given the best opportunities they can under some very, very difficult circumstances. And again, just saying that we all have a role to play here to make sure that, if we can all limit our contact as far as possible, wear masks, take those general precautions, then actually we can reduce some of the negative impacts that this pandemic is bringing. So I just wanted to mention about the digital poverty, really, because that does play in.
Yeah, and I think that there has been some evidence, as Toni said, around the impact on children, really impacting on the poorest children, the negative effect being felt much more greatly with those children. Owen, do you want to say anything about schools? I think we might have, Owen, are you on mute? Have you? Let's move on.
Sorry, were you coming to me next? I couldn't hear you.
I was, Owen.
So
I wondered if you've got anything to say about
Did you want me to
schools.
speak on the same subject?
Yeah.
Yeah, I've got to say I've got really mixed feelings about this. If I just take from my own personal experience, I've got a 15-year-old Year 11 son, and so far he's had to isolate for 28 days as a result of going in school, and then somebody who's in his sort of bubble in the school. But there are some young students, learners who are in his school who they've had to isolate for 4 different slots. So even since we've been open, so whilst I do get, quite legitimate concerns that Dipika's talked about safeguarding, for example, about people who are coming perhaps from more deprived communities and young learners and what the impacts are. There's another side to that, which is about young people carry the virus. And whilst so far to date, there isn't evidence that large swathes of those are, for example, at risk of death, what they do is they do carry the virus. They are carrying that virus back into a household, perhaps where they are more elderly or more vulnerable, or shielding members of their family. I think that is tough, and I also think the psychological impacts, about, for example, if a young person comes to understand that they potentially have brought the virus into their household, and God forbid something happens, somebody gets really poorly and whatever else, I'm not quite sure that we've really thought that through and what that might mean in terms of the psychological support that they might need. But the one thing I would say, that if we are still going to pursue this, and we are going to pursue that young people need to attend school, one of the things I would ask any parent out there is the simple question: do you know when your young on the bus, do you know if they keep their mask on? Do you know when they go in school if they've got an opportunity to keep their mask on? Do you know if your son and daughter does so? And if you don't, I'd really encourage you to kind of find ways of finding out, because if they are going to go to school, then whatever we can do to make sure that they do not pass the infection from one to another is really important. So that would be my view, Debs.
Brilliant, thanks for that, Owen. And I can see we will stop on schools in a sec. I can just see a couple of other questions we can probably answer really quickly. There's one around do we recommend that parents wear masks when taking collecting children from school? What I would say is, what we do is we recommend that people wear masks when they're with other people, when they're in the vicinity of other people as much as possible. I think we're getting quite a lot of reports of school drop-off and collection time that people aren't adhering to social distancing, people are stopping and having a chat. I think, we are in a national lockdown. We're not supposed to be out of our house other than to go to work if we can't work from home, picking up and dropping our children off at school, getting essential items and going out to exercise. So really, people, we shouldn't be congregating in the playgrounds or in the street outside schools. If we do have to wait because of the collection times between two children in a school, really important that we keep well away from other people and adhere to the social distancing. I have to be honest, I don't have school-aged children, but I'd wear a mask if I was going into the playground, just because I think we all need to do everything we can. And then there's a question around and universities and colleges and high schools and using sort of digital, a blended learning and using digital. And I do think, that schools are working extremely hard, and universities and colleges, to ensure that children continue and young people continue to get the education when they are having to isolate at home. And it may be that there are occasions when the amount of time that a young person is in school may need to reduce, and using this blended learning or digital learning is going to be really important. And I don't know if anyone wants to answer anything else on any of those questions. I think someone's asked a question around a balance between education and COVID, and I think there is a really fine balance, and Owen's articulated that really, really clearly. And what it means is that we do have to make a superhuman effort, the rest of us, to limit our contact with other people so that we minimise the negative impacts that children going to school is having on our COVID rates. So what I'm going to do is I'm going to sort of move on to another subject. And there's a question here, Owen, for you. That you've said, a question around what are the age groups around the people that have sadly passed away? Did the people have any other underlying health conditions? Did they die of COVID or die with COVID? Just a little bit of information, additional information, Owen, around the people that are being the most severely impacted really from COVID.
So typically we're dealing with an elderly population, sort of 60 plus, although there are numbers and pockets of people who sadly passed who are slightly younger than that, but usually it's about 60 plus. Typically what happens with most human beings who are 60 plus, there usually is an underlying condition somewhere down the line. But as I say, in our trust, we make the distinction between those where we attribute the sad passing of somebody to COVID versus attributing the sad passing of somebody else for non-COVID reasons. And as I've said, of that 115 that I talked about, 63 of those died attributed to COVID. I think the other thing to just talk about is also things like the gender and the ethnicity. We're seeing typically that it tends to be more male, so more men who are dying. And in ethnicity terms, certainly what we're seeing from the Calderdale and Huddersfield Trust is a situation effectively where somewhere in the region of nearly 90% are people of a white ethnicity, white British or white other. And I know sometimes that there are different parts of the country where that demographic will be maybe different. Possibly in my hometown, for example, of Bradford, that may be different. But certainly what we're seeing here is that elderly 60 plus, typically male, and tends to be white in terms of ethnicity.
Thanks, Owen. Toni, I don't know if you've got anything else to say in terms of what we know about the people that are most vulnerable.
I mean, I think Owen's explained it really well. The other things that I would add that are just emerging as risk factors are long-term conditions or chronic conditions that people might have, such as diabetes. If you're overweight, those are additional risk factors that we know that COVID can be more severe.
Thanks for that. And then there's another question, Owen, that while we're sort of talking about, I guess, the people that the hospital, there's a question here about will it get? Do we think it will get to the point? If the infection rate stays as it is, where that there'll be a time where nurses and doctors have to decide who to treat?
Sadly, we're already there, and this is the real dilemma. And as I alluded to sort of in my opening remarks, that's the real mental stress that is being placed on doctors, nurses and therapists at the moment. Is you're left with some really stark choices and judgments about which person might be more likely to survive if they're given treatment. And that's why we, like many other trusts, have what you would call internal ethics committees, so that when that sort of decision making gets to the point where you have got those really awful choices, that at least we make sure that we've tried to test our decision making against a level of ethics. There's no way I can put it, but it's horrible. And that's why we need to get the infection rates down. We need to get to a situation, because most of our clinicians, they will be able to turn the majority of people around, okay, if they have time to look after them. But when we're in the sort of situation we're in at the moment, time is reduced and the volume is heavy. You just haven't got the time sometimes to give people the love and attention that you would want to do. So that's generally what I would say at that particular point.
Thanks, Owen. I can see as well some questions about the support for people that need to isolate. So I can see there's a question saying that I've lost it now. There was a question asking, why is the COVID support only available for those that have tested positive? Saying that somebody's losing 2 weeks' wages having been in close contact with someone who's tested positive. And I think there's a couple of things to say here. I think I'd like to bring Dipika in really around the way that we support the support that we provide to people that are impacted by COVID. But I think just to explain that the support for people to isolate should be available to anybody who's been asked by NHS Test and Trace or our local contact tracers to isolate. So if NHS Test and Trace have contacted you to say you're a contact of somebody that's tested positive, then you should be able to get, if you're eligible, you should be able to get apply for the financial support. There are some criteria for that financial support that are based on particular qualifying benefits, particular criteria, and unfortunately what we are seeing is that we are seeing quite a small minority of people that apply for these grants at the moment being either eligible or meeting the criteria. So one of the things that we're in discussion with the government about is about additional discretionary support, financial support that we can provide to support people to self-isolate. But what I would say is that if you're in that situation, it's really important that you do contact the support hub, who may be able to sort of talk you through the support that you can get. And I know I'm going to ask Dipika to just say a little bit about the volunteer support that's available for people. But we can signpost people to see if there's another way that they can get financial support if that's possible. Dipika, do you want to come in on the support for people that are affected?
Yeah, so I absolutely appreciate that. Some people will need financial support, but also just to note that if you are contacted, if you have come into contact with somebody who has tested positive and need to isolate, then people should be isolating fully in line with the guidelines. And there is support out there for people whilst they're isolating. So, the support for picking up shopping, picking up prescriptions, taking the dog for the walk. So don't feel that the support isn't there. So currently we've got the virtual volunteering hub, and if people actually need support, or actually if people can offer help as well, those people who are not isolating, who are able to offer help through the volunteer hub, please go through the hub. So basically the information is calderdale.gov.uk /coronavirus/help, and there's a phone number as well, 01422 288 001. And you'll go through to customer first at Calderdale Council, and what they can do is basically find out what your support needs are, and then signpost you to the relevant service, whether it's part of the council or whether it's through the voluntary community sector. But I can assure you, support is there. We have an army of volunteers who are ready, willing, and able to support people in local areas and do this very, very safely. And I think just one more thing, Debs, I'd like to raise that actually people should be thinking, and I've for my family and myself, we've already thought about what some of our needs might be if we had to isolate as a family. So actually start thinking about those personal isolation plans for yourselves, for your family, thinking about what support you might need, and actually, think about getting all those numbers and details in place. So basically they're there at a touch of a button, because like I said, the support is there, and it's really important that if we need to isolate, we are doing so absolutely fully. And again, just to reiterate what Owen said around protecting people, protecting the NHS, but basically saving lives. Thanks, Debs.
Thanks very much, Dipika, for that. That's really helpful. And I think, again, one of the things that we've heard is a little bit of confusion about what self-isolation means. And it's really clear. It means staying at home and don't have any visitors. So I think Dipika's suggestion there, actually, of developing your own personal self-isolation plan, getting ready in case you do need to isolate, so it's a really good idea. And that do please use the website and the numbers that Dipika's mentioned. So I'm just looking at the other questions. I think there's some questions here about why do we think the infection rate is increasing? Why is it so high, especially as we're in a lockdown? And I think one of the things that's really important, I'll start if that's okay, and then I think I'll probably hand over to Toni. But I think it's really important that we understand that when we had the first lockdown, it was probably about 10 days after the lockdown started that we started to see the impact. I think we're just about at that point on the data we've got now, so that we're probably only just expecting in the coming days to see an impact of the lockdown on the infection rates. I think when we've done work in looking at, well, where are people being exposed to the virus in Calderdale? What are the settings? What are the areas? What are the groups? I'm really sorry to say that it's everywhere. The virus is in all of our communities, in all age groups. When we look at where transmission is happening, it's happening in workplaces, in transport, in communities, in school settings, in households. So it's really, the virus is out there in our communities, and obviously that's why it's so important that we, I think, really make a superhuman effort in the next couple of weeks while we're still in the lockdown to limit our contact with other people, to wear a mask as much as we can when we are with other people, and to stick to that self-isolation if we're asked to. Toni, have you got any insights into why the infection rate might be so high at the moment?
So, I mean, Calderdale, similar to the rest of West Yorkshire, has had quite high rates throughout the summer. Not as high as what they are now, but it has been higher than other parts of the country. There's definitely been a bit of a north-south divide. I'm sure we'll be, trying to unpick this for many years to come. But when you look at differences between the north and the south, we know that, some of the types of jobs that we do in the north, it's much harder, to do those jobs from home. So we have more people out in workplaces, in frontline jobs, in key professions. Also, there's something I think around the way in which we live. So overcrowded housing, it's harder to isolate. So if we get one case in a household, that number very quickly escalates. So that one number turns into 4. In other households, that number might only go up to 2. So when we think about lockdown and how long it takes to have an impact, we know that someone infected today probably won't show symptoms for another 4 to 5 days. They'll then get a test. And it's only after about a week that number will show up in the data. And linked to the household transmission, which is very, very likely, just because of the close proximity people live in, that one number then turns to 3 or 4 or 5. So that's why we probably have about a 10-day to a 2-week lag from putting an intervention or a restriction in place to seeing that in the data. So clearly now is around the time we would expect to see that. But, given that people are still going out to work, and we know that, as Debs has said, it is really going to be a superhuman effort to bring this number down. So the fact that people are still in the workplace, in these frontline professions, in these key worker jobs, means that we have to be even more disciplined in terms of our social lives, in terms of not having household visitors, really, really limiting social contact outside of, work settings.
Thanks, Toni. And there's a question here, quite a technical question, and again, Toni, I don't know if you can answer this, around false positives. And there's a question around the what's the impact of false positives? Is that influencing our rates, our figures? I don't know if you can respond to that.
No, so I don't think it is influencing our figures. The test, the swab test that we do at special sites, which then goes off to a lab, it's a pretty good test. No test is 100% perfect, but at the minute we're asking people with symptoms to get tested. So the combination of a positive test alongside those symptoms is quite a strong indication that you've got COVID infection. So in my opinion, that's not influencing our rates. Our rates are high because there's a lot of infection out there, and there's a lot of infection in the community.
Okay, thanks, Toni. And then I can see there's a question about conspiracy theories. There's a question about sort of negative, suggesting people aren't listening, that people aren't taking it seriously. So I'm interested. I mean, I think interested in what people's thoughts are about the various conspiracy theories, about what we need to do to counter those. Interested in perhaps Owen. I might start with you with that. Have you got anything to say about the sort of negative responses, people not taking it seriously, and the various conspiracy theories?
So I think there's a reality which we accept.
Owen, have we lost?
Sorry, Debs, can I just check? Can you hear me? Okay.
Yeah, we can hear you now. Yeah.
Hello.
We can hear you. It might be that you can't hear us.
Hello.
Yeah, it looks like Owen's struggling to hear us.
Sorry, it's just that I can't. Yeah, I can hear you. I don't know if you can hear me.
We can. Yeah, we can.
I think he's frozen again, hasn't he, Debs?
Yeah, I'll tell you what, I shall pass on to you, Dipika, about conspiracy theories and negative.
Okay,
sorry, Owen.
So my story around this would be,
again, I think we've lost Owen. I think it's usually me that has the technological problem, so I'm quite relieved it's somebody else today. Although I'm sure Owen has a really, really important point to make. What we'll do is we'll move round. I'll ask Dipika and Toni, and then hopefully Owen will be back to give us his view. Dipika.
Okay, so in response to the fact that whether this is a big conspiracy, I can tell you within our sector, we see live cases on a daily basis in terms of how this is impacting people, your neighbours, your communities. the people right across Calderdale, and this is people of all ages. You know, it's affecting children who've lost loved ones. It's affecting families who've lost loved ones. It's affecting those people who can't get help, support, treatment because of the increasing number of cases going into hospitals, into other services. So I think that the way we need to, we need to stop thinking that this is a conspiracy. This is happening. This is real. This is affecting everybody. Everybody's lives is being touched and impacted by COVID. And you know, again, I can't reiterate. I can't say how important it is that we all take stock. That if we don't work together, if we don't take those simple precautions, this is only going to get worse, and we're going to lose a lot more people. And our services are going to come under pressure, and our communities are going to be feeling this for many, many more years to come. And our children, of all people, are going to be really impacted from the way their lives have not only been disrupted, but how their futures will be disrupted, and our economy, our businesses. So this isn't just about, you know, this being a big conspiracy. I don't think anybody would want to think that they would disrupt the world this much. So from my perspective, this isn't a conspiracy. This is reality, and we all need to work together to make sure that we tackle this problem together, not only as individuals, but as communities, as Calderdale, and as a nation as well.
Thanks, Dipika. And I think, I mean, it's you know, I really do understand how tired people are of restrictions. You know, Calderdale's been, we had a national lockdown. I think we had about a month, didn't we, where we weren't in a lockdown of some sort or under some sort of restrictions, and then we were back in them for, you know, at the end of July. So I do understand that people are tired and frustrated. But you know, back to Owen about the sort of your reflections on the sort of conspiracy theory. Owen, we lost you, but it's great to have you back, because we knew you were saying something really, really important. So back over to you.
I think you know, the reality is that we live in diverse communities, and therefore you know, people will always have different opinions, and it's always difficult, I suspect, particularly with the concept of social media and so on and so forth, to get to a place where you can sort of like all corral around a single truth. So I think there's a thing about just recognizing that there will always be somebody who will have a different point of view. All I would say is even if you believe that this is a grand hoax, or you believe that this is a part of a conspiracy theory, at the end of the day, for us all to get to a better place, for us to imagine, you know, that one day we might be able to go and sit, for example, in a restaurant or go in a cinema at a point in time, we won't get this done if we don't do it together. And that's the fundamental point I would try and get across. So wherever you are on the spectrum of this, whether you're somebody who absolutely believes it and is doing all that they can, or you're somebody who's at the other end of the spectrum and thinks it's a conspiracy, neither party is going to be satisfied unless we come together. And some of the things that we can come together, and I think this is the thing, is we can actually do this. We can wear masks, we can socially distance, and we can sanitize and wash our hands. And, you know, my plea would be, if we can just do those things, wherever you are on that spectrum, we can all end up in the place where we want to be. And I think that's what I would try and get across. I think trying to get to a place where you convince somebody who has a totally different point of view to you on some of this stuff. And, you know, I could show people pictures of what it's like when people are sadly having their last gasps of breath and how awful that is. But I just know that that of itself is not enough for some people. So I'm just hoping at some point we'll get people to understand that wherever you are on that spectrum, to get to the place we all want to get to, we have to do it together.
Thanks, Owen. Thank you. And there's a couple of questions here about what will happen on the 2nd of December, and also a question about Christmas as well, and what we can expect from Christmas. So I don't know, Toni, should I start with you on that one?
Yeah, I think the answer is quite easy in that I don't know the answer. I don't think any of us know what will happen on the 2nd of December or at Christmas. I think so much depends on what we do over the next couple of weeks. You know, lockdown essentially is a way of buying time, and we really, really need to get the infection rate down in that time. I think the lower we can get the number, the more options available to us come the 2nd of December. But we shouldn't be thinking that it's all going to go back to normal and we'll have a normal Christmas, because the bottom line is the more social contact and interaction that we have, the more infection we'll have. So the number will just go back up again. So I think if we can get the number down as far as we can over the next 2 weeks, then there'll be a decision taken by government around, what the approach might be around, different tiers or rule of 6, or what kinds of businesses can open. I think it's all to play for, and it's really in our hands. We've done it once. We've locked down before, and we were really successful at bringing that number down. And that only happened because people worked together and people were committed to do that. I think it was one of the questions about, are people not listening? People are listening. We know that the overwhelming majority of people are following the rules, are staying at home and only making essential visits, or leaving the house for work or shopping. And I think we just have to kind of keep going. And you've said it before, Debs, people are fatigued. I'm tired, 10 months in, I'm exhausted from all of this. But, we can do it.
Thanks, Toni. And Owen, thinking about Christmas from your perspective and the end of the lockdown, and Christmas from the perspective of you, I guess, in your staff and your patients. I've learned that if I speak, Owen will speak.
Yeah,
so
again, I think, it's a similar thread, that what we want to get to is a situation where, as far as possible, sorry, I don't know if I've frozen again, it's hard to tell.
No, carry on, Owen, carry on.
No, I don't think it's working.
Okay, well, Dipika, you move over. You do Christmas. Talk to us about what your thoughts are around the Christmas.
I don't know if you can hear me. Sorry, it's really difficult. What I was just trying to say is that clearly it's a really challenging time, because not only do people.
Owen, we can hear you. Oh dear. It's just there must be I think there's a really big delay for Owen. So I think what we've heard in terms of the sort of the end of the end of the lockdown period, and thinking about Christmas, and I think is that we probably can't expect to have it depends, I guess, on how we enjoy Christmas. I know I'm conscious that the local lockdowns were implemented on the night before Eid, and that had a really really devastating impact on some of our communities, and was really difficult. And I think Christmas is probably going to be different, but I think Toni has said it's in our hands. And the more we do now, the more likely we are that we'll be able to meet with other people over the Christmas period. I think we've done it in Calderdale before. We had very, very low rates over the national lockdown. We kept our rates low by working together, by supporting each other. We then in the summer our rates were very high, relatively, not as high as now, but relative to other areas. And again in August we made a real superhuman effort and we brought those rates right down. And we were, I think, on the brink of coming out of restrictions. And then in September, you know, the rates went up again. So we've done it twice before in Calderdale. So I'm absolutely certain we can do it again. If we rally round, work together, support each other. And I guess, you know, one of the reasons I was really interested in hearing what Owen's got to say is because what we know about the virus is that when the rates are high, it's often around 2 weeks before people start to become very ill and need to go into hospital. And I feel we really owe it to our colleagues who are in the NHS and social care, who are dealing with the consequences, and they will be dealing with the consequences of the very high rate we've got now in a month's time. And if they're going to be able to have any sort of break at Christmas, you know, we have a responsibility to really urgently support our NHS and social care colleagues to bring this under control. Owen, in terms of the next steps, it's great to have you back. You tell us your reflections.
So I think, Debs, and I'm really hoping and praying you can hear me. I think what I would just say is it's really, really, really important that we understand that it's not just Christmas is not just one event, if you know what I mean. And what I mean by that is we need people to understand that if we don't take the right precautions around Christmas, we'll find ourselves back in a very difficult place again. And I'm really trying to encourage as many people as possible to try and be responsible. And the best Christmas gift that you can give colleagues who work certainly within CHFT is the opportunity for them to be able to look after their patients, because we are open at Christmas. But what I think people would just appreciate is just the opportunity to be in a position whereby they can care for their patients, and if it is remotely possible for some of those patients also to be able to see relatives socially distanced, we'd like to try and do that, although that is really, really.
Oh dear. Really important point there from Owen. The hospital will be open.
Yeah. Sorry, Deb. Can I just add to that? I think again, it's that key message, isn't it, that we all have a role to play. Yes, I think we do need to take precautions as we're coming towards Christmas, but thinking about those people in care homes, thinking about those people who are, you know, highly vulnerable. I think, you know, we have to be honest with ourselves that Christmas is going to be a very different affair this year. And actually, if we do everything we need to do over the next few weeks, few months, then maybe we can recover some of this come next year, this time next year, hopefully. You know, and we know that there's a lot of talk about vaccines as well. So I suppose it's like you said, Debs, you know, we've done it before, and yes, we're all tired and we're all fed up, but actually let's kind of, you know, dig deep and get through this together, be responsible, and also think about our healthcare staff, our care staff, you know, and our friends and families really as we're thinking about moving towards the festivities, because everything we do now is going to kind of have an impact on what happens come early next year and beyond.
Thanks, Dipika. Toni, do you want to add anything?
I think I'd really just ask people to think about what matters to them. So from a personal perspective, you know, I've got young children in school, and my ultimate kind of driver is to maintain that for them. I don't want them to be a contact of me because I'm a case and them to lose out on their education. You know, others will have children or elderly relatives. who will be at risk if they catch the virus. So it'll be different for everybody. And Owen and Dipika have rightly talked about, our health and care staff and volunteers who have worked, tirelessly for 10 months now. So whatever it is that motivates you, think carefully about that, because your risk is my risk. We all share that risk together.
And it's interesting, isn't it? Because it's really complicated. Lots and lots of reasons that we don't fully understand why we see big increases in infection rates. But actually, reducing the infection rates really simple. The things we have to do are really, really simple, and they're the same things we've been talking about, aren't they, for the whole of the year, really, the whole of the 10-month period. And that really is about washing our hands, and respiratory hygiene, so covering our mouths when we cough and sneeze. It's about limiting our contact with other people. This virus spreads by people being near, close to other people, and the best thing we can all do, is reduce to the absolute minimum the contact we have with other people. And then there are things that we can do to keep safe, to protect ourselves on those, rare occasions when we are with other people, hopefully for many of us. And that is about wearing a face covering. And then finally, and we know that there's a lot of people that don't have symptoms, so that may be spreading the virus without symptoms. But actually, when somebody has symptoms, goes for a test, gets a positive result, it's really critical that they isolate for that full 10-day period. And we've talked, haven't we? We've heard from Dipika about the support that's available for people to do that. And recognising it can be hard, but develop your own personal isolation plan. Think about what you can do, because if you have symptoms and a positive test result, the biggest thing you can do for Calderdale and for your community and for our colleagues in the NHS is stay at home and don't have any visitors for that full 10-day period. And if you've been exposed or been in contact with someone, the same applies, because you may unwittingly, without realising it, spread that virus on. And breaking that chain of infection is absolutely critical for us to, move forward and recover from this. So I really agree with Owen that the Christmas and the whatever happens, whatever restrictions we're under on the 2nd of December, those things that reducing contact with other people, wearing a mask and isolating if we test positive or have symptoms, that will be, they're still the most important thing we can do, whatever the restrictions are, whatever we're doing over Christmas and the festive period. They're the most important things that we can do. So I'm really grateful. According to my my computer's clock, it's 2 minutes to 8. So I'm just going to ask everybody to just finish, just Toni and Dipika, and then Owen, if he gets back in, to just any concluding comments that you would like to make. And I'll start with Dipika.
I'd like to make a slightly different comment, if that's okay. I'd just like to let people know about Calderdale COVID Champions, if that's okay, because it's a really important initiative. And actually, this is an opportunity for local people across Calderdale to help people in your communities, your friends, your family, your network, to stay safe and support your local community, to respond to and recover from the effects of COVID outbreaks and help prevent COVID outbreaks as well. So can I just ask people to, if you are interested, if you feel that you do want to play a part, an active part in helping us to fight this battle, just go online, type in Calderdale COVID Champions, and there will be a programme of training rolled out for people. So get engaged. Be part of the fight. I think we're all, as Toni said earlier, this doesn't just affect me, it affects everybody else. We're all in this together. So it's about making sure that, we take those simple precautions, we play our part, and we work on this together, really, to get back those freedoms, protect our loved ones, and keep our livelihoods.
Thanks,
Thanks,
Debs.
Debs.
Toni, any final comments from you?
I suppose my final reflection would be, I suppose, a cautious one. We're very, very careful, I think, around people that we don't know. And my plea would really be around, we're most likely to, be infected by people we spend a lot of time with. So that means we know people. And conversely, those are the times when we feel most safe, when we're around, our loved ones and our friends and family. So I really think for me, it's just a word of caution is around those social distancing and reducing your social contact. This is about people that you know and spend time with, rather than the stranger that you walk past in the street.
Okay, I can see there's a question that having said it's a concluding comments, I can just see that there's been quite a lot of questions about enforcement, and I think it might be just worth just saying a little bit, just as the final part of this, just a little bit about the work that we're doing on enforcement. So there's quite, I understand there's people asking questions about what's being done to enforce the rules. And we actually have, as a council, we're working really closely with the police. We're doing a lot of work to enforce both the COVID, the restrictions to businesses and to individuals, and also the self-isolation rules as well. Thousands of visits have been taking place in Calderdale since in the various stages that restrictions have been underway. Visits where we get intelligence from people telling us that perhaps a business or a workplace isn't adhering to the restrictions. So our community protection team, our environmental health officers, our community wardens, and when it involves an individual, our colleagues in the police, we do go and visit. And what we do is we use something called the 4 E's. So what we do is we explain what the issue is, we engage and try and understand. And then we educate so that the business or the person or the workplace really understands the implications. And then ultimately, if we still don't get compliance, we will enforce, and we have issued a number of fines, a number of fixed penalty notices. We have actually, closed a number of premises as well because they weren't adhering to the restrictions. So while I think it's really important that we all understand that enforcement is part of the patterns and the picture and the responsibilities that we all have to address this. The council and our colleagues in the police do take enforcement really, really seriously, and we have a really comprehensive programme of enforcement activity. So I just thought it was worth mentioning that, because I've got a comment on my screen that says there's lots of questions about that. So we are at 8:03 now, so I am going to close the session. I'm really sorry we didn't manage to hear a bit more from Owen, but it was really great. I'm very, very grateful to Owen, to Toni and to Dipika for joining us and answering the questions this evening, and really appreciate you all, the people out there that are watching, spending the time watching and joining us this evening. So thank you very much, and have a good evening.